Welcome to Trudy, Haynes and Company. Today we're going to start a series on affordable health care. I want to say that correctly because some people misinterpret Obamacare and they put the two together, but it legally is affordable health care,
the Patient Protection and Affordable Care Act.
Affordable Health Care Act.
Yes.
And I have two people who are in the know about this act, how it's going to affect you when you get involved, if you don't get involved, and how we're going to break down what you need to know about this particular Health Care Act. And I'd like to first welcome, in the white coat, Dr. Edward J. Alexander, and he is the CEO and Administrative Director of Rising Sun Medical Hospital, or Medical Center. And this young man I just met, he's part of the Logan family, I just found out, and welcome.
Thank you.
His name is Bill Feggings. He is president of DIG, which stands for?
Divine Insurance Group.
So you're a minister?
No, I mean, it just was an acronym that I decided to have, Divine, to keep me in check, to make sure I'm doing my job accurately, to help, navigate or advocate, insurance services and financial literacy programs to seniors and people in low income the populations in targeted areas. So that's why I named it Divine Insurance Group.
Well, we like that too. So we got heaven and earth with us today to help to explain this act that a lot of people don't understand and don't know how it's going to affect their lives. So I want to start off with one particular question. Is the Affordable Health Care already in a law?
Yes, it is a law.
Okay.
It's been a law since, I think, March of 2010. Was tested in the Supreme Court in 2012 and found to be constitutional. And by way of the president winning by a significant majority of Americans on both the popular and on the electoral vote status, shown that this law basically stands. So it is law. It is law.
So all this bunk about overturning it and stopping it and all that is, we don't have to pay attention to that right now.
Well, if there's some powerful things going on in Congress.
Correct. Very powerful.
So we'll have to see. But I think that's not the normal way that legislation is overturned. Usually it's overturned by both both congressional bodies, usually debating it and then having a vote, which then goes to the president's desk, whereby he's able to either veto it or accept it. If he vetoes it, then you have to get a two-thirds majority in both houses in order for that law to become law. So the way that they're doing it right now isn't exactly the standard way that our Constitution.
So right now we're faced with a law on the books.
Yes.
And it's legal.
Yes.
Why did it take so long for us to start using it?
Well, if you allow me, the problem is that the law had phases in which it had to be instituted. For instance, this is a huge bill in the sense of, just like the Medicare system and like the Medicaid systems, they have to be brought in phases because it involves setting up administrative bodies to make sure it's working, getting in the proper personnel, making sure the law is properly interpreted. So in order to do this properly, you just can't throw something like this at the people. So it was actually in a very in a scientific and appropriate way, was moved through stages so as to have most success and really not throw our healthcare system into a kilter.
So we're ready to start with enrollment.
That's correct.
Signing up.
Correct.
And this is what your job is to do, is to
Correct.
explain it to people.
Correct.
So what does that mean, sign up?
Well, right now, tomorrow will be October 1st, and that's pre-enrollment. And people have between now to shop. And they're going to shop all around the country. Based on their state, they can either shop for a state exchange, or they can do a federal exchange shop. And they can choose a carrier within their own health savvy. If they're health savvy, they can go on a computer and go to the federal exchange website, and they can navigate through
a lot of people don't have that. Wait a minute.
Right.
Let's bring it right down to the nitty-gritty.
Right.
When you say shop, we're offering affordable health care. Does that mean everybody can go and get it?
Well, everybody who's uninsured can go and get it.
Then the answer is no.
Everybody that's a lawful
can.
person. Everyone
Okay.
that's a lawful person can get it.
Okay.
18 years and older.
Okay. And if they have insurance,
Well, this is why the system is designed to actually perform in a proper manner. The system is designed to bring in individuals who don't have insurance or who cannot afford the present insurance.
All right, so everybody is not entitled to this.
Right. For example,
Those who have insurance, they don't have to worry.
Exactly.
They have any kind of insurance, Medicare or Medicaid.
Correct.
Right now, they're safe.
Yes.
Okay.
And employers of large businesses also cannot drop those people from their insurance, so those people are technically safe also.
Correct. That's
Okay.
correct. Let's debunk
Okay.
that.
So they
And-
can't be dropped.
Right. And
But it's
and
the people
small
that don't
business-
have any kind of insurance, Medicare or Medicaid, that we're concerned about right now.
Yes, and small businesses.
And small businesses.
Yes.
Okay. What does that mean? That they can go sign up for affordable health care?
Yeah, see, the advantage of having, if you're a small business, the advantage of being able to go in and sign in on the exchanges is that normally, if you're a large company, you can afford to handle, because of your the monies that you're producing, you can afford to pay for those insurances, and you also have a large number of people in your company, so you have a better rate. Whereas as a small company who goes on the market, because you have a smaller population, you're paying more for that insurance dollar. I mean, you're paying more for that insurance. With the new system where you go into exchanges, this allows small businesses to, in essence, pool and become, in essence, similar to a large business, and therefore their insurance rates, the insurance rates for the individual small businesses will be less. So this is actually an advantage for them.
Correct.
For small business.
For small business.
Now, what about the individual getting health care? He doesn't have or she doesn't have any kind of health care.
Well, then that person can either use a certified navigator that will help navigate
Certified,
them.
what's the certified navigator?
Well, navigator is what you're going to hear about. I mean, a lot of city council, state reps have call centers for navigators to help people shop.
That's what we've been getting indulged with.
Right, but here's let's debunk some of the myths about the navigators. A navigator is not licensed. They're only certified to shop. They can only, there's 4 plans with the ACA, Affordable Care Act. There's a bronze plan, there's a gold plan, there's a silver plan, there's a platinum plan. They're by metals. Okay, and the job of a navigator is to help them gather their information first. That's all their household income. That's their Social Security.
You mean from the person?
From the person, right.
They're going to take my Social Security, all the information where I live.
Bank account information, where you live, and your household income. Now, mind you, these people are hired, they're certified, they only make maybe between $8, maybe between $10 or $12 an hour. And someone is giving them a lot of information for them to navigate them to a web portal for them to go on to select what metals that they want. Remember, I just
one of those
metals?
4
right.
divisions.
But that doesn't mean they selected a carrier, and here's the problem. So let's say this client has pre-existing conditions. It could be COPD, it could be heart failure, it could be cancer, it could be some terminal illness. Now, mind you, it's going to be based on their income. The income is between 2% to 9.5%, okay, of their household income. Okay, so if you have a husband and wife and one person loses their job, it's still dependent on their household income for that person to have a health coverage for them. Okay, so they can't get around it. So you're going to have to pay it. Okay, now depending on that income, you can select what plans you want. And majority of that income, let's say if it's 2% or 9% of your premiums, will go towards health care. At least 80% of it will go to medical health care. The other 20% is for admin fees. So, for example, let's go back to pre-existing conditions. Since anyone can get and go on the exchange and help them, they have nobody to help them pick the carrier that's for their needs. And I'm not going to name any carriers, but let's say you live in the Philadelphia area, you have a predominant carrier here that most people know of, and you may have some other health insurance carriers in this state that they may be unaware of. And so you got to look at network issues. You got to make sure that your doctors and specialists are in the network. You also got to make sure
well,
that...
how can we do all of that?
Well,
the average person can't do all of that. So
well,
This is... go ahead.
Well, that's why they can use a licensed health insurance agent that has their health insurance license on the line that will be held in jeopardy because, number one, we're licensed with the state.
Is that you?
And that's me.
Okay,
And they can go to divineinsurancegroup.com. That's DIVINE, divineinsurancegroup.com, and they can read about the Affordable Care Act online to see what income chart they fall under, and they can have a licensed agent to help enroll them into an actual plan based on their needs and their pre-existing conditions, because you don't know if a deductible, yes, and their income, because you don't know if a deductible may come up. If a person needs dialysis and they can get it, and they didn't have any coverage, they just got dialysis, but their income's too high to get Medicaid, and they're not a senior, or they don't have SSDI, they don't have Medicare. This person we call in-between. This in-between person needs care immediately, and they need major medical immediately. They need coverage. They need their dialysis. They need every a few days, so 3 times a week. Okay, but if the person can't technically afford a copay because their income is a little high and they don't get a subsidy towards their copay, if they pick the wrong plan, and they may need to pick the platinum plan from a good carrier that the deductible is either 0 or maybe $100, they won't get service. They'll have to meet the deductible first. That's why they need to have an insurance agent and not just go through a navigator, because like I said, a navigator cannot select coverage for you by the carrier and break down your pre-existing needs or what you need to get based on your health.
So the boys would say, you're the man.
Well, yes. I would say I will be the person that will make sure that anyone who's uninsured, make sure that they get a plan based on their household income and their needs that are met, because most people who will be getting on these plans will have pre-existing conditions.
All right, now let's go back just a little bit. If you have Medicaid, Medicare, if you have a working plan now,
correct,
you're pretty much safe for a while.
Yes, and you can shop if you have an employer plan and you choose, let's say if your employer decides to push you off and say, you know what, go to the exchange yourself, we'll give you a small contribution towards your own health insurance. They can do that, and that's kind of what's been going on out here now with a lot of these chains of retail, let's say restaurants or retail merchandising stores that are out here. They're pushing people to the exchange to get coverage themselves, and it's going to be based on their total household income, not just their income, their household income. Because if somebody else and they're married and they're bringing in another income, they go to a new income bracket.
In other words, you can see how complex it can possibly be without the proper guidance, and that's, I think, what Bill and his organization offers is that guidance. Now, there will be, as we said, these navigators and coordinators out there, and they serve a purpose, at least in terms of trying to bring people into the system.
Correct.
But without that kind of expertise that Bill offers, then we can see ourselves having some problems. Now, as this go along, I think, he pointed out a very important issue, that as this system is going along, of course, it's going to be it's going to become another political football, because when they see people not getting properly signed up, well, they're going to look at it as another failure. It's not about failure, it's about expertise.
Correct.
And in this case, this is why this is important, that someone like Bill and other organizations like them be involved in helping to get people signed up for the Affordable Care Act.
All right, so we have a time now to sign up. Until when?
To January. Right now, they can call Divine Insurance Group if they need guidance at 1-888-591-4430, or they can go online to divineinsurancegroup.com, and they could fill out a quote, and we'll have a licensed agent contact them to go over a plan based on their needs and based on their income. That's what they need, and then we can walk them through a plan with a particular carrier that they may want, because we still got to look at the network too as well.
Well, what gives you the background that we can say, okay, you're the man?
Well, I can tell you this. For the last 10 years, I've been really advocating health insurance services for individuals and small businesses. And that's what I've been doing. And me going out and seeing thousands of people speaking on multiple radio stations, appearing on multiple TV outlets, I've been doing my service. Right, of course, and your channel too as well. And as they can read a bio on me, they can go on LinkedIn.com and type in William Feggings, and they can go and have a whole biography about me and see what I do.
Okay.
So that's what I've been doing.
All right, now we're going to come back, folks, because there's a lot more to talk about. So just stay tuned or join us tomorrow, the next day. We'll be right there on the web so that you can follow what we're talking about for the affordable health care and how you can get help.